Have you ever wondered? So many students follow the same coaching material, they use the same resources, follow the same MCQ books as well as MCQ Q banks. But when they sit in the exam, why is there so much of discrepancy in their result? There are many reasons for that. Yes, there is a role of individual brilliance. There is also a role of how much of hard work you have put in. There is also an element of luck. And that is also true that many of you, most of you will be doing MCQ practice. But one fine important aspect many students tend to miss out, and that is understanding and developing the skill, the art of solving MCQs. Yes, my dear friends, MCQ solving is a skill, it is an art. Some people know it inherently, and for some, you need to develop it. And here I am to help you out in this endeavor. Hi everyone, I'm Dr. Sandeep Sharma. I'm MD Pediatrics from PGI Chandigarh. I'm a practicing pediatrician. At the same time, I'm also an educator. I've been training students for NEET-PG, FMGE, INICET, NEET Super Speciality, as well as INI Super Speciality exam. And here I am starting with a series called as The Subtle Art of Solving MCQs. In this journey, which will be a multi-part journey, I will be trying to unravel the world of MCQs for you. In this episode 1, we will try to talk about the rules that you must remember for solving MCQs. I will be giving examples in each category. And whatever stage of preparation you are in, whether you are beginning your MCQ preparation or you are already in your advanced stage of preparation, you are going to benefit from it. In the coming days, in the coming videos, I will be talking more about the subtle nuances that can help you, even if you have prepared really well, that can help you in getting that extra edge in the world of MCQs. So let us begin the game. Let us begin with the episode number 1. Before I start with, you need to understand what are the MCQs. Most of you know, but still we have to start. So multiple choice questions are those questions which have a stem of initial statement, and then you have to choose the best answer among the options given. The options can be either 4 or 5 based upon the type of exam that you are using. And generally these MCQs are used in competitive exams ranging from NEET-UG to NEET-PG, then INICET, FMGE, and even NEET Super Speciality, INI Super Speciality. Even your UPSC and CMS exams also, along with USMLE exams, also have these MCQs. So the question arises, what are the types of MCQs and the marking in them? Broadly speaking, there are 3 types of MCQs in the medical competitive exam. First are the fact-based questions called as one-liner MCQs. Second, you have the clinical scenario-based MCQs whose weightage every year is rising. And third are the image or visual-based MCQs, also called as image-based question. They can either be in the form of a spotter, like they'll give an image of an X-ray and ask you the diagnosis, or more importantly, they can make a case scenario, mention an image, and then ask you the diagnosis. They can ask you prognosis. They can ask you multiple points. In various formats, it can be asked to you in the exam. So these are the 3 ways MCQs are generally imagined and asked. And the marking varies according to the paper pattern that you are sitting in. In certain exams, there is no negative marking, for example, FMG. There is -1/4 negative marking in NEET-UG, NEET-PG, as well as NEET Super Speciality, and -1/3 negative marking is there in INI-CET exam. Let us try to understand a few rules that will help you do better compared to others when it comes to the art of solving MCQs. Let us first look at rule number 1. What is rule number 1? Destination is more important than journey. Now you might have heard about this famous quote. It's there in a book called as Alchemist as well, that the journey is more important than destination. That is true. But when it comes to MCQ exam, how you reach the answer, that is more important rather than knowing the nitty-gritty. Whether you applied a concept, whether you use some mnemonic, or whether you simply ruled out the option, if you reach the correct answer, that is what really matters in the end. So end is important. The ending, the climax of your MCQ should be appropriate. Let us have a look. Let us try to take an example of how you can reach a correct answer. How you can reach a correct answer in 2 ways. First of all, have a look at this example. This is a pharmacology MCQ. So what is not a side effect of cyclophosphamide? Now there are 2 ways of reaching the correct answer. Either you know all the options, or you know that which is not a correct answer, or you can apply the existing knowledge, rule out the options, and reach the correct answer. My dear students, you need to understand that in MCQ entrance exam, as much as 30 to 40% MCQs are those where you don't know the precise answer, but by ruling out the options, you can reach the correct answer. Have a look at this question. If you are even an average or above average student in pharmacology, you would know that hemorrhagic cystitis is a known side effect of cyclophosphamide. Secondary leukemias is a known side effect. Secondary malignancies is common in them. And alopecia, that is loss of hair, also occurs as a part of chemotherapy given when cyclophosphamide is used. So either you can know that when you read the topic of pseudotumor cerebri, among the causes of pseudotumor cerebri, cyclophosphamide is not mentioned. You can use that knowledge to reach the answer, or you can apply the pharma knowledge and know that A, B, and D are the options which are known side effects of cyclophosphamide. So which is not a side effect? The odd one out here is pseudotumor cerebri. You can solve this question in two ways. Either you read the topic from pharmacology and know it precisely, that helps you in ruling out your option and reaching the correct answer, or you have read the topic of pseudotumor cerebri in medicine or pediatrics and you know that in the list of causes of cyclophosphamide, a list of causes of pseudotumor cerebri, cyclophosphamide is not mentioned. Applying that knowledge, you can still reach the answer. Don't be apologetic about it. When you solve MCQ, the answer is important. You can rule out the options and reach the correct answer. So remember the first rule, destination is more important than journey. Rule out options, that is as good as knowing the correct answer. Next, we have rule number 2. The rule number 2 says identify the contradicting options. Many times you will have statement based question where two or more options will be contradictory and the answer will be among those contradictory options. Let us have an example. So this is an example of an actual MCQ which was asked in one of the exam. Suppose you have not read the topic of congenital CMV, right? Let us assume that you have not read the topic. Let us apply some logic and read the options carefully. So reading the options, reading the question, even if you have not read the topic, is still important and still it can help you in reaching the correct answer. How? Which of the following is not true? So basically this question is asking you the false statement regarding congenital cytomegalovirus infection. Option number A, CMV is most common congenital infection. It is actually true, but let us assume we don't know about it. Option number D, ganciclovir is needed in severe symptomatic congenital CMV. Again, it is a true statement, but let us also assume that you have not read the topic, so you have no idea about D. Now look at option number B and C. Splenic biopsy is preferred sample for screening, and option C says saliva is preferred sample for screening. Now, if you see carefully, option number B and C are contradictory. There cannot be two preferred samples. It can either be saliva or it can be splenic biopsy, and only one option is correct, and they are asking you have to identify the false statement. So the answer should be between B and C because these two are the contradictory options. These are the contradictory options, right? We have not read the topic, right? I'm assuming. If you have read the topic, great. So contradictory options. So answer has to be among B or C. Now apply some logic. There is a congenital CMV. So it is either a fetus or it is a newborn. Suppose a newborn you are evaluating and it is screening that we are doing. Screening is done in apparently asymptomatic individuals. Would you think of collecting saliva for testing, or would you put a biopsy needle all the way into a spleen, which is a vascular organ? And if you have read enough medicine and surgery, you would know splenic biopsy is virtually never done in any condition, right? So splenic biopsy will not be the preferred sample if you apply some logic and common sense and apply the things that you have seen during internship. And so they are asking the false statement, and B is the correct answer. B is the correct answer. Why? Because the preferred sample is saliva. A, C, and D are true statements. B is the odd one out, and B by logic also is not a correct answer. It might look simple right now. It will require practice. It's like learning to play cricket, learning to swim, learning to ride a bike. Initially, you will stutter, initially, you will fall, initially, you will need help. But the more practice you do, the more your skill will start to develop, right? So look for contradictory options. Even if you have look for contradictory options, understand that you have now a 50% chance of getting the answer correct, right? So this is second example of how looking for contradictory option can help you in narrowing down the option and reaching close to the correct answer. Let us look at rule number 3. Rule number 3 says there is no perfect person and there is no perfect answer. Ask yourself, are you perfect? No. Is your life partner or is your girlfriend or boyfriend perfect? No. Is your crush perfect? No. You may think that your parents are perfect, but ask them individually, they will also say they are not perfect. So there is nobody, no such thing as perfect person. Similarly, there is no such thing as perfect answer. You are given 4 options. Many times you will not find the perfect answer, but you have to identify and go with the best possible answer among the options given. So try not to overthink in such scenario. Let us take an example of another MCQ. So MCQ says, what is the next step in management of any child presenting with suspected severe acute epiglottitis? Now all you need to know is that there is a condition called as acute epiglottitis. Epiglottis is the opening of the airway, and there is itis means inflammation. So it is a severe, it is acute severe bacterial infection of epiglottis, right? That is what this condition is. Now look at the 4 options. So it is a acute severe bacterial infection of epiglottis. Look at options one by one. Option number A, do X-ray and observe. It's a severe infection, choking can occur, so that will not be the answer. Start steroids. Why would you give steroids in a bacterial infection? Not the answer. Start acyclovir. All you need to know is a rudimentary knowledge that acyclovir is an antiviral, so not indicated. Start antibiotics. Now, when you read the topic of epiglottitis, the guidelines say that the first step in the management is always intubate the patient. You have to secure the airway because many times choking can occur if the airway gets occluded, and it can happen in a severe progressive acute epiglottitis. But intubation is not given among the option. So what is the next best answer? Obviously, after intubation, you will be starting with fluids in the patient and you will be considering IV antibiotics because it is a bacterial infection. So what is the best answer among the options given to you? D, start antibiotics. And that is why when you read, when you prepare, you should not be remembering it as one-liner. One-liners may be asked in the exam, but if you have read clinically and if you have read and understood the topic, it is easier for you to understand. Please understand that many times MCQs will be there where there is no perfect answer. You have to identify and mark the best answer among the options given to you. Let us move further and have a look at rule number 4. You need to watch out for options like all except and options like none except. Let us take an example. So, none of the following show intracranial brain calcification except. None of the following are showing brain calcification except means they are asking you to identify which is having brain calcification. If they say all of the following except, so they are asking you to identify the negative thing. Here they are saying none of the following except, so they are asking you to identify the positive thing. What is the condition in which brain calcification can be seen in the patient? And if you look at the options among them, congenital CMV is the one where periventricular brain calcification has been described. Now, without having any knowledge, you cannot sit in the answer and mark, but understanding MCQs, you have read the theory, you know that congenital CMV can cause brain calcification, but read the option carefully. All of the following except, none of the following except. In the competitive exams, sometimes 5 to 10% of all statement-based questions are having these kind of statements. So watch out and don't make error. If you are having a difficulty, say it out in your mind in your native language. Whatever is your native language, for vast majority of us, English is not our native language. We tend to think in Hindi, Tamil, Telugu, Punjabi, or whatever is your native language. So say it out in that and then try to think, if I have to explain this to myself, what should I be saying in my native language? And you would understand what the question is trying to say. Let us have a rule number 5. Do not overthink. Common sense works many times. One example I've already given you. Another example we'll see here. Alzheimer disease. You all know what is Alzheimer disease. Not only medicos, even non-medicos know what is Alzheimer disease. As age advances, there is accumulation of degenerative material in the brain neurons, which causes Alzheimer disease. This is a most non-technical way I can explain the disease, right? So question is asking you which is not a risk factor, because the word except is there. So which is not a risk factor? Look at the options. Old age more than 80 year would be a risk factor. Option number A, because we know that Alzheimer disease occurs in old age. Positive family history. Let us assume you have no idea, although it runs in the families. Option number C, APP gene mutation. Again, we assume that you don't know the answer. Option number D, childhood KRAS gene mutation. Is Alzheimer disease a childhood disease? No, it is an old age disease. So why would a childhood rare KRAS gene mutation? KRAS gene mutations, by the way, are involved in multiple type of malignancies, and they are associated with multiple childhood malignancies, and you can say germline mosaicism and germline malignancies in the patient, right? So they are not associated with the condition of Alzheimer disease. Now, if I have to mark this question, provided there is no negative marking, I would apply my logic, and 8 out of 10 times, if you apply the logic properly, you can actually reach the correct answer. Point of caution, if there is a high negative marking, you would avoid this strategy. And in exams like INICET or super specialty, this logic approach does not work. But in exams like NEET-PG and FMGE and even NEET-UG exam, this type of approach works beautifully. So apply logic and reach the correct answer. And then we have the rule number 6. Longer the question, easier the answer. In this world today, when a lot of limited time is available for you in reading the question, where clinical questions are being asked, sometimes you can get into trouble. Have a look. Suppose you are sitting in the exam, only last 3 minutes are left, and you encounter this question. Now, this question with only 3 minutes and clock ticking in reverse, there is a very good possibility you will not even read the question or even just leave it. Whenever you have a long question and running short on time, always start from the last 2 lines, and you will have a better chance of getting the answer correct. So remember, start from the bottom. Which of the following is the drug of choice in scrub typhus? So basically what examiner has done is he has given you a history and laboratory test about scrub typhus. Just to waste your time, he has just given you an entire story about it. In the end, what he has said is, what is the drug of choice in scrub typhus? And the drug of choice in scrub typhus, which is a rickettsial infection, is nothing but doxycycline, and that is your answer. It is an actual medicine MCQ. Now, if you read it, basically, if you have time, you can read the entire one, and you would notice that there was a trekker who went to Himalayas, hilly areas, forested areas. There will be a higher chances of getting a bite from the trombiculide mite. The scrub typhus, Orientia susugamushi vector, Orientia susugamushi, the agent would have gone into the body, and that would have produced an eschar. You can see the eschar is also mentioned. There is hepatosplenomegaly, which is there, positive wheel Felix test, and transaminitis, all of them pointing towards scrub typhus. So if you are running short on time, last 2 lines, not always, but at least 5 to 6 out of 10 times, it will give you a correct answer, because it will summarize. Examiner has a tendency to summarize in the end as well. Again, this approach does not always work in INICET or super specialty exam, but it works like a charm in FMG and NEET-PG exam, right? So if you are running short on time, read the last 2 lines. They may give you a correct answer. And then you have rule number 7. Avoid taking risk in fact-based one-liners if there is negative marking. As I said, there are 3 types of MCQs I told you. One was the fact-based question. Either you know the answer or you don't know the answer. Second is scenario-based question. I've given you an example. And third are the image-based questions. So rule number 7 says, if there is negative marking, particularly high negative marking like -1/3, don't take undue risk in fact-based question. Suppose you have to take a risk, take it in a clinical question, take it in a statement-based question, take it in a image-based question, because you have a better chance of getting the answer correct. Sometimes logic works there. Have a look at this question. This is an actual MCQ. Have a look at this question. Even if you are a topper, or maybe you are having a distinction in ophthalmology or in pediatrics, I'm quite sure that there is a strong possibility you will not remember in the exam. So the question is asking, retinal angiogenesis begins at what gestational age in a fetus? This is a fact based question. Unless you know the fact precisely, or it is a previously year repeated question, the chances are only 25% chance that you will get it right. 75% chance that you will lose numbers if there is a negative marking, right? So such question do not attempt, provided you have done enough attempt in the remaining questions. So when you have to take a chance, don't take in fact based question if there is negative marking. If there is no negative marking, for example FMG exam, you have to attempt everything, right? And when you attempt everything, again, don't look for the extremes of ages, always go for the middle values, which are usually the correct answer. But in negative marking exams like NEET-PG and INICET, avoid taking undue risk. By the way, the answer to this question is 16 week. It is a old multiple choice question. You can add it to your notes also if you want. That retinal angiogenesis begins around 16 weeks and it is completed somewhere in the third trimester. In fact, it continues post birth also, and it is totally completed around 40 weeks of gestation. Right? So, retinal angiogenesis begins at this age. So, what are the rules that we have discussed? The 7 golden rules. Rule number 1, destination more important than journey. Apply logic, rule out options, reach the correct answer. Rule number 2, identify the contradictory options. Generally, in a statement based question, these options, two options which are contradictory, one of them will be the answer. Rule number 3, there is no perfect person and there is no perfect answer. So go with the best possible answer among the options given. Rule number 4, watch out for all except as well as none except. Rule number 5, do not overthink, apply common sense, apply logic. Most of these questions you will be able to identify. Of course, you need to read a bit as well. Without reading, also, you cannot sit in the exam. Rule number 6, longer the question, easier the answer. Start from the bottom and you will have a better chance of getting the answer. And rule number 7, avoid taking risk in fact based one liners if there is negative marking. If there is no negative marking, you are supposed to mark the entire paper. So, this is episode number 1. What to expect in the next week? Next week, I'll be coming with episode number 2. Things will get more serious, things will get more fun, things will get more productive because we'll be talking about how to solve a clinical MCQ if you have forgotten or not read the topic. Yes, if you have not read the topic, how to rule out options. So, art of solving MCQ, art of ruling out option, and reaching the correct answer, we will be taking with more examples. But trust me, my dear friends, all these techniques will only help when you practice yourself. So, theory and MCQ, balance. Life is all about having money and having contentment, having your family and finding the me time, having a good food, and at the same time, not saying no to fast food at certain times. So, it is all about balance. So, get that balance going, and we meet again. You can follow and subscribe to the channel, and you can also put your queries on Instagram. Episode number 2, I'll be coming with this ruling out options and reaching the answer in clinical MCQ. And episode number 3 will be a summary in which I will take up even more contentious issues. So, see you and all the best.